Whenever you have any type of addiction going on, it tends to have a domino effect. So you'll have the drug addiction and then the spread of disease. And a lot of those diseases are from injecting. Some are, drug addicts that have HIV, hepatitis, and other infectious illnesses, and they're spreading it among each other. Sex for drugs. Look, whenever you have a drug situation, you can expect almost anything to become part of the fallout from it. It's not just about doing drugs and then dying, but there's a lot of other things that you have to deal with as well, and including homelessness for many of these drug addicts. So this came out in nature.com, and it's the US opioid plague is driving a spike in infectious diseases. Look, the two are going to go hand in hand. And, ladies and gentlemen, you're talking about an addiction that has gone on for 20 years, and there's still no end in sight. Despite of the fact that they have thrown money in this thing, they have done everything above and beyond to try to get treatment for these people. They created drug court because, see, they don't want to mass incarcerate their people. They don't want to do that to their own. It was okay to do that to us during the crack epidemic, but not good enough for their people. So they've created a separate drug court. They've given these addicts amnesty, all kinds of perks, safe injection sites, and the list goes on and on. They have spent over $1 trillion on this opioid addiction, and it's still here. It's still here. And it's worse than ever. So opioid addiction kills tens of thousands of people every year in the United States, and the trend shows no sign of slowing. Now, public health officials are worried about a surge in bacterial and viral infections linked to opioid abuse that threatens to compound the crisis. So, most of the common things that are happening, especially like in rural areas, is HIV. I've been seeing a lot of hepatitis and HIV, and a lot of skin infections also, because of constantly injecting into the skin. It's causing infections. And I've seen some of them, and they look nasty, y'all. They really do. Research groups around the country are working to understand, identify, and treat these outbreaks. But the lack of solid data on the number of new cases and where they'll crop up next, as well as stigma associated with drug use that can prevent people with infections from seeking early treatment, is hindering efforts. And not only that, many of these folks out here are refusing any type of treatment or rehab. And they're grown-ups. What are you going to do? You really can't force them into it. This is like HIV all over again, says Judy Feinberg, an infectious disease physician at West Virginia University in Morgantown, comparing the current crisis to the HIV epidemic. Boy, do I remember that. That dominated U.S. public health efforts in the 1980s and 90s. People are stigmatized. They don't feel they deserve to live. They hear people say it's a lifestyle choice. So now they're saying over 20 years, the use of opioids, including prescription pain medication, heroin, and synthetic drugs such as fentanyl, has skyrocketed in the United States. And all of the fentanyl come from China, y'all. All of it. As of 2017, there were roughly 15 opioid overdose related deaths per 100,000 people in the country. Now, they're lowballing these numbers. You got to understand, they're ashamed of this shit. So they are constantly lowballing the numbers. compared with 3 per 100,000 in 1999, according to estimates from the US Center for Disease Control and Prevention. Now, ladies and gentlemen, I was looking at articles and just looking at things locally. There's a lot of young people now seeing cardiologists from having all types of heart problems that they really shouldn't see until they're in their 60s and 70s. They are now seeing at a much younger age, in their 20s, some even in their teens, getting heart valve replacement. They shouldn't even be doing that at 18, but they are now. And it's all because of the drug addiction that's going on. So you got a whole slew of young people now at heart doctors, and they really shouldn't be there at their age, but they are. And that's how, that right there is a sign of how bad drug addiction is in the US. One type of opioid related infections that researchers are grappling with involves diseased heart valves. So there you go. Okay. So all of that synthetic drugs that you are injecting into yourself is destroying your heart. Some of these young people need heart transplants. It's that bad. They said, you now, if you go to a cardiologist, before you would see older people sitting in the lobby. Now you see a whole bunch of young people. And because they do all these drugs, they are now seeing a cardiologist for things that they shouldn't even be there for. So, in an ongoing study, microbiologist Cecilia Thompson at the University of North Carolina in Chapel Hill is sequencing DNA from heart valve collected from people who had surgery to replace diseased valves with artificial ones. Thompson found that valves taken from people who had injected drugs were more likely to be infected with S. aureus than those with, those that are non-users. Ladies and gentlemen, because they declared this thing as a public health issue, many of these junkies have no fear of being arrested. So if a person have no fear of being arrested, do you really think they're going to get off of the drugs? It's just my opinion. Nobody has to agree with me. The way they are handling this whole thing, y'all, they are enabling all of this drug use going on in America. See, they are hell bent on not mass incarcerating these folks because it's so many people on these drugs, y'all. They would literally have to mass incarcerate their own people. That's not an option. This is why they get on the soapbox. It's a public health issue. Nobody should go to jail. Well, you sure didn't have that opinion during the crack epidemic. So now you are looking at a situation that has spiraled so far out of control, they cannot do anything to reel this thing in. It is too many people on these drugs, and there's no way of tracking all of these junkies in the country. If you can't stop the drugs from flowing in, what are you going to do with the addicts? You can't do a damn thing. So, in my opinion, this is their fault. This is their fault for handling this whole drug addiction this way for 20 straight years. This is their fault. I mean, who else can you blame? You're the ones that made the decision to make this public health and not do anything. You're the ones that made the decision to give them drug court. All they got to do is go to rehab and go back to drug court and get a pat on the back and go back in the streets, and then they fall back to the drugs. Ladies and gentlemen, I did a video probably more than 3 years ago now that said the average opioid addict that goes to rehab, 90% of them do not make it. They said it's one of the hardest addictions to beat. And more than 90% of them don't make it. They end up falling off the wagon and going right back to the drug. And just looking at the way things are going in this country, I believe it. I don't even sweat telling how many people are dying a year because I know they're not giving you the actual number. If you remember, the CDC only reports from 22 states. That's it. Not all 50. So you are never going to get the real number. I don't believe they want that out here. And I know the real number is bad. That's why they're hiding it, and they're not ever going to tell you what it really truly is. Ladies and gentlemen, I have seen the little tent cities. I have seen these addicts stumbling around, and I have been panhandled too. A few of them have come up to me to panhandle for money. So they are out here and they are visible. Now, you may not see them as much around in your area, but there are some areas in the country, there's no doubt about it, that you are walking around and you are seeing these people, or you're driving in your car and you suddenly see some of these addicts stumbling across the street in front of your car. I saw one that was holding up traffic one day. So it is a bad situation out here. That's why in my state, they're now giving away free Narcan to try to get the public involved, because you know what? These EMTs, these cops and fire departments, they're tired of going out to these addicts. I know why they're doing it. They're tired of going out here and seeing the same people over and over and over overdosing on drugs again. Same person. But please tell me what you think, ladies and gentlemen. I'm not surprised about the disease spiking up. If you're not going to do anything about the drug addiction, you can expect this to happen. You can also expect many of these babies that come from these junkies to have all sorts of problems. I did a video probably about a year or two ago on babies born addicted to opioids have smaller head sizes than normal. So you see all of the problems coming down the pike from these generations coming up. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.